Good evening, everyone. Welcome to Floridians for Democracy's May program in our Florida Democracy at Risk series. Did anybody know democracy was at risk? I'm one of the co-founders tonight of Floridians for Democracy, and we're thrilled to have nearly 200 signed up registrants, and some individuals are in groups where they'll listen to the program and have some discussion afterwards, which is something we'd really like to encourage in the future for many of our programs, where people use them for dialogue with friends, relatives, churches, community clubs, etc. We're honored to have as our keynote speaker, Dr. Scott Rivkees, who's going to speak about the assault on public health. You already knew that because you signed up for this. Dr. Rivkees follows our April program, where we are blessed with another physician, Dr. Kate Arnold, an OB-GYN specialist who is bravely speaking out on many of the freedoms being taken from us, especially women's reproductive rights that place women and infants at risk. Tonight's format, we will have Dr. Norbert Goldfield, I'll introduce him shortly, introducing Scott. Following Scott's comments, an excellent moderator, Mike Canary, an interviewer, will interact with Dr. Rivkees and ask him some questions to get everybody warmed up. And then we'll have general Q&A time. Since this is in a webinar format, you will be muted, but we do want your questions. So please put your questions in the Q&A section on your screen. You can use the chat to share with everyone, share your thoughts, comments, etc. But if you want a question asked of Dr. Rivkees, you need to put it in your Q&A. On behalf of the Board of Directors of Floridians for Democracy, we want to thank you for your trust and support in our efforts. If there's one thing the last few months have taught us, it is clear that to protect and preserve democracy, it is incumbent on each of us to be educated, to speak up, to speak out, and to support all efforts to get out the vote. Now, in Florida alone in 2022, 2.8 million registered Democrats did not vote, and over 2 million registered no-party affiliates did not vote. We cannot count on our elected officials or the courts. We are the ones who can make a difference. It's now my honor to introduce you to a very special physician, Dr. Norbert Goldfield, a practicing internal medicine physician from Springfield, Mass., who is an author and medical researcher. Dr. Goldfield is the founder of two impressive organizations. One is Healing Across the Divides, a 20-year-old effort designed to assist marginalized Palestinians and Israelis in measurable health improvement, a truly difficult mission that became even more challenging on October 7th. The second organization is how we're all here tonight. He and his organization are our partner for this evening's program. It's called Ask Nurses and Doctors, easily referred to as AND. It's a bipartisan venture whose mission is to help elect congressional representatives and a president of the United States who will prioritize the solution of U.S. healthcare problems, so to educate as well as to encourage people to run for office. Dr. Goldfield, Norbert, we are thrilled and honored to have you and looking forward to you introducing our special keynote speaker.
Thank you very much, Jim, for that very kind introduction. Again, my name is Norbert Goldfield, and I'm the founder and executive director of A&D. We are so pleased to be partnering with Floridians for Democracy. Floridians for Democracy is just such a wonderful organization and a critical organization at this very time. So I can't overemphasize how important it is. As part of that, I want to just give an introduction to Scott Rivkees. We definitely are so pleased to be having you. Scott is a physician. He is a graduate and served as faculty at Mass General Hospital and Harvard Medical School. Before moving to Florida, Dr. Rivkees served as professor of pediatrics with tenure at Yale University. And then he moved to Florida and worked at the University of Florida as chairman of pediatrics, and then moved on to be Florida Surgeon General, after which he now is working as professor of public health at Brown University, and he consults with public health departments throughout the United States. It's an honor to have you. I look forward to having lots of questions in the Q&A. And so we're particularly interested in hearing your voice. And thanks so much for joining us tonight, Scott.
Norbert, thanks so much. All of you, thanks so much for making time on a busy weeknight. It's great to be on the call with many friends, acquaintances. I see Dr. Martin on the call, who we work together. It's really great seeing you again, Mike. Yeah. So again, yeah, it's a real honor to speak with you all this evening. And I had the incredible honor to serve as State Surgeon General during the pandemic. It's interesting, but many people are forgetting about the incredibly harrowing times that we went through. We are faced with a new virus, different biology than other viruses we had before, and really had an incredible impact on so many of us. We've lost 1.1 million Americans to this virus, and it has changed many, many lives forever. Being in Florida, the third most populous state, gave me the opportunity to interact with many individuals at the federal level, at the state level during the pandemic. They went to see what was happening in Florida, and I had to know what was happening nationally. And here are some of the individuals that I had the honor and pleasure to work with. Many of you'll recognize Deb Birx, U.S. Surgeon General Jerome Adams, CDC Director Rob Redfield at the time, FDA Commissioner Steve Hahn. Also had the opportunity to meet with the Vice President. Shown here is when we had a press conference in February. That was even before we had our first case in Florida at West Palm Beach International Airport. And then in the bottom picture, you'll see the first press conference we had about COVID-19. Here I am standing next to Governor DeSantis, Lieutenant Governor Nunes, and to my right is Deputy Secretary Shamariel Robertson. When we were faced with COVID coming to Florida or coming to the country, we knew we had a very daunting task ahead of us. This is a virus that really had tremendous effects on individuals who were older. We knew this from early information that came out of China and other parts of the US. And Florida is probably one of the most medically vulnerable states in the country because of the fact that in terms of individuals who are 65 years of age and older, Florida ranks number 2. Florida, with about 22 million individuals, we had more than 4.5 million people older the age of 65, and at least another 2.5 million individuals who had underlying medical conditions. And we began preparing for this really as soon as we had heard about this. And this was the plan that we followed in the Department of Health throughout the pandemic, and referred to this as the STEPS plan. And these were the pillars that we focused on each and every day. Social mitigation measures, including non-pharmaceutical interventions, COVID-19 testing, contact tracing, elderly and vulnerable population protections, preparing and supporting hospitals and providers, and then stopping the introduction of COVID-19 into the state and also into congregate facilities. Now, there's a lot of talk about how different states did during the pandemic, and looking at Florida, I think it's important not to lump everything together, but actually look at what happened in Florida in really 2 phases. The pre-Delta variant phase, the Delta variant hit our state at the end of June 2021, and what happened afterwards. So before June 2021, the first 18 months of the pandemic, there was very high reliance on measures that we implemented in the STEPS plan, particularly in elderly and vulnerable population protection, and also very aggressive vaccine promotion. When Delta, but after early in 2021, this is when we started seeing the rise of the anti-vaccine movement, rise of misinformation. This left a substantial segment of Florida not vaccinated. And when the Delta variant hit, it took a really serious toll on our state. In fact, during the Delta wave, almost as the number of people who passed away in the 4 months of the Delta wave was about 70% of what we had seen over the preceding 18 months. And Florida went from being 29th in death per capita to now about 8th in death per capita. And the death rate for COVID-19 of Florida sadly exceeds that of the rest of the United States. So one of the questions we have to ask ourselves is, why did this shift occur? Let's talk about deaths due to COVID-19. So, every time we give these talks, I always do them with a heavy heart. It's really staggering to reflect on the fact that more than 1 million people in this country have died from COVID, and people are still dying from COVID. So if you look at deaths from last year, 2023, due to COVID, we had more than 50,000 individuals die from COVID, which is more than twice the individuals who died from flu last year. Typical flu year, about 20,000 people will pass away. And already this year, we're on pace for having 40,000 individuals pass away from COVID. 90% of the deaths now are in people 65 years of age and older. But this is a critical point. In 2024, more than 90% of the deaths from COVID-19 are now preventable if individuals are vaccinated and if they get COVID, get treated with the antiviral agents, including Paxlovid and Molnupiravir. So if we look at Florida in terms of what's happening, there have probably been about 100,000 individuals who have passed away from COVID. Last year, more than 5,000 individuals in Florida died from COVID. And so far in 2024, more than 2,000 people have died from COVID. And again, going back to this really important point, with COVID vaccines and treatment with anti-COVID viral agents, mortality, even in the populations most at risk, should be largely preventable. So why are people still dying of this virus? If we look at vaccination rates, we find that Florida went from having one of the better vaccination rates in the United States, particularly for the first doses, where 85% of people in the state end up getting at least one dose, to now a situation where Florida lags behind the rest of the country. And in terms of the recent booster shots introduced last year, the updated COVID vaccine, only about 16% of people in Florida ended up getting vaccinated. Now, Florida has been very unique in terms of the anti-COVID-19 vaccine shift that we are seeing in our state. The policies that are now being put in place are very different than what took place when I was Surgeon General, and very different with the other states. So if you go back to the beginning, when vaccine first arrived in the state of Florida, we were very aggressive in terms of promoting vaccination. In the picture, in the photograph, this is the first individual to receive a COVID vaccine in Florida. Standing over the individual giving the vaccination is Governor DeSantis. And to the other end of the picture, this is Jared Moskowitz, who was Director of Division of Emergency Management. As you know, Jared is now a United States Congressman. And if we went into early 2021, vaccines first became available in December of 2020. When you go into early 2021, Florida actually led the nation in the percentage of individuals who are most at risk, 65 plus, in terms of vaccination. But we ended up seeing a progressive shift. So first, we ended up seeing in March of 22, guidance coming from the Department of Health saying that healthy children should not be vaccinated against COVID-19. So in the United States now, about 2,000 children have died from COVID-19, far in excess of the number of children who died from influenza over this period of time. And the fallacy with this recommendation is that half of the children who have died from COVID-19 did not have underlying medical problems. And when vaccine became available for children 6 months to 5 years of age, Florida was the only state not to pre-order vaccines for this younger age group, which can be especially vulnerable to COVID. Then we had another announcement, which came out in October of 22, saying that young adult males should not be vaccinated because of a risk for cardiac deaths. No risk for increased cardiac deaths has been corroborated at all. And then we had continued evolution of the anti-vaccine messaging, saying that now individuals less than 65 years of age should not be vaccinated against COVID. 20% of the deaths of people from COVID-19 in Florida are individuals less than 65 years of age. And now we're in a situation where after the start of the new year, a recommendation came out that no individual, regardless of age, should be vaccinated with the messenger RNA vaccines. And there's no alternatives that are recommended. No recommendations for the protein-based vaccine, no recommendations for the antiviral agent. So this really leaves the question, how are we going to control COVID-19 in Florida? Again, a state where the population is very at risk. Should also point out that in terms of these vaccines, and this is similar for flu vaccines, the protective effect lasts 6 to 9 months, which is why you need to have the updated boosters on an annual basis. Let's also talk about measles. Measles, an extraordinarily contagious illness, much more contagious than COVID is. And before measles vaccines became available, more than 500 children a year would die from measles. It's an illness with considerable morbidity as well. So in the United States, like other parts of the world, we're now seeing an increase in cases of measles. And in Florida in February, in a school in Broward County, there was an outbreak of measles that was present there. What was not unusual about an outbreak was the response to it. So typically, measles is not new. We know how to take care of measles. Measles is so incredibly contagious. Individuals who are not vaccinated and exposed should get vaccinated within 3 days. If you're exposed and you haven't been vaccinated, you need to isolate, because individuals can be contagious well before they come out with the rash. But rather than following standard public health measures followed all around the world, all across the country, it was now up to the parents to decide whether their child who's exposed to measles and is unvaccinated, who potentially could spread it to other individuals, could now make the decision themselves as to whether their child can go to school and potentially expose other children. Fortunately, this outbreak occurred at a school that had an outstanding vaccination rate of 97%. So of the 1,000 children, the number of children who are at risk was very low, which is why this really did not spread. And in terms of what was announced afterwards, it said that this is a matter of personal liberty, personal freedom, personal choice, parental rights. And for those of us in public health is about protecting the public. So the next question is, if we get an outbreak of measles in another area of Florida, how are we going to control it? What if suppose if that school had a 70% vaccination rate, 50% vaccination as opposed to 97%? So one of the things that we are actually seeing is we're seeing an attack and denial on core principles of public health. And there's a concept which is referred to as denialism, which really talks about what causes people to really reject the truth. This involves many facets, and it's important to recognize this to know what's going on. Attack on experts, claims of conspiracies, such as that COVID is introduced by the pharmaceutical companies to profit, use of fake experts, creation of impossible expectations, such as why should we get vaccinated? It's not 100% protected. No vaccines are. In terms of attacks on the expert, in August of 2021, when we were in the midst of the Delta wave, we saw attacks on Tony Fauci. We saw Scott Atlas joining the White House COVID task force, espousing the herd immunity philosophy, which also came out of the Great Barrington Declaration. The Great Barrington Declaration were a number of individuals, and they proffered the notion that the best way to get out of COVID is to allow individuals with lower risk, those who are younger, to get COVID, to build up herd immunity, protect the rest of the population, focus protection. Well, this doesn't work because of the fact that, first, young individuals, first, they can get sick from COVID and have significant morbidity. And second, they're going to spread it to other individuals as well. So the herd immunity approach really is not something that is embraced in public health. And as noted here by John Barry, could actually lead to millions of more cases and many preventable deaths. So this raises the question, who are going to listen to for expert advice? We also are seeing an impact of COVID on legislation. So all across the country, we're seeing legislation being introduced, many places being passed against vaccines, against mandates, against masks, against quarantines, against public health activities, things that will curb the ability to control school outbreaks. And here is a map. This is from April 2021, showing the different states where anti-public health legislation has been introduced. I was a state health officer. These are tough jobs. Certainly harrowing experience, that we all went through. So during the pandemic, more than 60% of the state health officers have left. The average term now of a state health officer is about 1.6 years, and about 30 of the state health officers are now in their first year. These are positions where experience matters. And in terms of the public health workforce, more than 50% of the public health workforce has now left. And in terms of anti-vaccine legislation, we're also seeing this pop up all across the country. Efforts in some areas to get rid of requirements for children to get vaccinated before they go to school, something which has been affirmed for more than 100 years. So we have to ask ourselves, what are the long-term consequences of this anti-public health legislation? Is our society going to be safer? Is our society going to be healthier? And one of the things that I think is especially chilling that we have to wrap in this conversation are these anti-public health messages? Is this anti-public health, anti-medical philosophy? What is this doing to what's referred to as just culture and psychological safety? Just culture is a process which is embraced by many hospital systems that decreases medical errors by saying, let's have a conversation about what is going on. Can we have open conversations about different perspectives? So when the state says no vaccines for people less than, for anybody of all ages, can we have an open conversation? When the state surgeon general says it's up to parents to how their child should handle a measles exposure, what kind of conversation are we having about that? So in terms of some of the things that have happened in Florida recently, or actually for the past 2 years, and these are detailed in one of my commentaries recently in Time magazine, is that a tenure used to be something that was very sacred at different universities. And now processes are in place where tenure faculty members will go up for a review and tenure can be revoked. This has the possibility of stifling speech. Physician speech, we typically, as a profession, would regulate messages that would go out, but now, as we'll talk about a little bit, that's not happening. In terms of influences on university curriculums, such as banning psychology as a core course for some of the majors at the different Florida universities, a grand jury investigation, and the Public Health Integrity Committee. So in terms of some of the things that have happened in the state now, so it used to be that, if a physician would get off track, would be making public comments that could actually potentially harm the public if they were in a medical organization. The medical organization could potentially have a conversation with them or that hospital, particularly with credentialing. But now that won't happen because now the possibility of us being able to regulate ourselves has been challenged. There also is now this Public Health Integrity Committee that's supposed to look at, how the state had managed the pandemic, other public health issues. And the individuals who are on this committee are individuals who have largely embraced the Great Barrington Declaration. And then also now there is a grand jury trying to look at COVID-19 vaccines. No other state in the country has done this. And in terms of the grand jury, I find it very concerning that after the first report came from the grand jury, and we don't know who speaks to these individuals, that the report was used in a political way rather than in a bipartisan way. So the question we have to ask ourselves is what is going to happen when just culture of public health, just culture of healthcare ends up being eroded? Now I want to give another example. This is a shout out to the state of Indiana, where Governor Daniels, Republican governor, he created a bipartisan commission, 15 individuals, a representation from schools of public health, healthcare sector, public. And what this commission did, they actually came up with some good specific recommendations. Not just that, they put together more than $200 million in new public health funding, which is going to make public health structure in that state even stronger. So in closing, what can we do? So first, we really have to depoliticize public health. Our public health workforce is really challenged now. It's dwindling. It needs support. It needs recruitment. It needs new training. We really need to make sure that we're following core public health principles. As I talked about with measles, we shouldn't be innovating with measles. We know how to take care of measles. I love the idea of bipartisan commissions. Some other states may be adopting this. And we have to be able to enable just culture. When certain kinds of recommendations come up, do we feel comfortable in being able to voice our concerns? And in terms of the medical community, which is us, what can we do? So first, medical organizations, have a big voice and they help bring us together. So it's important that we continue to work with local and state medical organizations. Healthcare coalitions are very useful. Credentialing groups, again, I think we have to really revisit the issue as to whether if somebody does things, makes statements so publicly, ends up promoting certain kinds of treatments that could potentially be harmful. What is that organization? What can they do? And then it's very important to continue to reach out to elected officials. They need to hear from us. They need to have a voice that they can trust. And then also, as physicians, we really can continue to speak to our patients to make sure that they can trust us and that they continue to reach out to us to be able to have the questions that they have answered. So at this point, let me thank you for your attention. And again, It really is an honor to be here with your group.
Now, Mike Canary is going to interview Scott for about 15 minutes, and then we'll have open Q&A. Please use the Q&A on your screen.
Oh, hi, everybody. My name's Mike Canary. I'm a producer and host at WGCU. We are the NPR station for Southwest Florida. Our studio is on the campus of Florida Gulf Coast University. Dr. Rivkees, my first question is how has the way the pandemic has played out informed how you and others are teaching students who are heading toward the field of public health?
Yeah, that's a great question, Mike. In terms of my role at Brown now, I'm teaching students and teaching them about COVID, about the pandemic, leadership, communication. And the first things is that public health has the potential to be incredibly impactful. As a physician, you take care of one patient at a time, but in public health, you take care of tens, hundreds, thousands, millions of individuals. So it's a way where you can really have a big impact. So it's important to have students recognize that this is a field where they can make a difference. But on the other hand, we talk about the challenges that they are going to face. Even before the pandemic, we saw attacks on the experts. And then certainly during the pandemic, this heightened. And now we're really battling this other pandemic of misinformation. So, we need to make sure that students understand what is happening, that they can make an impact and recognize the trends that are happening that they're going to have to be able to address later on as public health professionals.
You talked about how there's a lot of people who've left the field of public health. Is this also impacting the ability to attract people into the field of public health to begin with? Are you seeing registration or, application numbers down from historic numbers or anything like that?
Yeah, that's a really interesting question. Certainly during the pandemic, there was an absolute surge in the number of people going into public health and masters in public health programs. We are still continuing to see that at our universities. But speaking with people in departments of health all across the country now, one of the issues that they're having now is that they've had a lot of individuals actually leave their departments, and they're having difficulty recruiting individuals who want to serve, in the public sphere.
Is this a common topic among your colleagues these days? If you're at a conference, if you're talking at the cocktail hour beforehand, is the sort of general anti-science, anti-health messaging and, paradigm shift something that you guys chat about?
Yep, so absolutely. So a couple of things. So first, departments of health all across the country are talking about issues related to workforce, recruitment and retention. And then also, how are we going to battle misinformation and disinformation? Things can pop up very, very quickly that individuals may believe things that are not factually correct. So a big focus in public health now, and certainly going forward, is how are we going to be more effective communicators? How are we going to be more rapid communicators? And how do we help the public realize separating fact from things that actually potentially could be harmful statements?
I think this sort of is an obvious question, but it's also evidence of sort of where we're at. Should the approach to public health ever significantly differ from one state to the other?
The short answer for that is no. In terms of controlling outbreaks, in terms of the core principles of public health, environmental health, infectious disease control, building community coalitions, community health promotion. These are all core beliefs that all states have. States, though, are different. Some states may be more rural, some states may be more frontier, some states may be more urban, and that's one of the beauties about public health and how things are set up, is that each state can recognize what their special opportunities are and what their special vulnerabilities are, but the core principles of public health across all borders.
If you don't mind, I'd like to go back to the early days of the pandemic when you were here in Florida. Could you have imagined that it would wind up playing out the way that it did in terms of the partisanship becoming bound to the perspective on how we should address a global pandemic? Could you have seen that coming, or was that sort of as it developed, were you finding yourself being like, I can't believe this is happening?
Great question, Mike. I mean, so I'd say, despite all that was happening with the politicization, of the pandemic, those of us in the Department of Health, we really stayed true to our mission in terms of the core principles, which I talked about in the very beginning. But there's no question that what we are doing really became more challenging with the rise of misinformation, false information, anti-vaccine messaging. Never in my wildest dreams could I ever imagine that here we have a million people have died of COVID in the United States, 50,000 people who died last year in the United States from COVID, and really a disease now that really should not be fatal. And we are having people dying because they are afraid to get vaccinated. They're afraid to get these antiviral agents. And this is where we really have seen such an incredible paradigm shift related to the false information, the misinformation, which has been spread, that is very difficult for us to overcome. I thought once the pandemic died down that this would go away, but we're not seeing that.
Do you think it's linked directly to how polarized we are in this country? In other words, the pandemic rolled out during an election year.
Right.
We are polarized, generally speaking. It's gotten to the point where it's almost like if the other side says it, we have to respond against it by like knee jerk. Is that all just how we wound up here in some ways?
You touch on a really important point. Public health now has become a political wedge issue. Vaccines, mitigation measures, what we do with the schools. We really end up having a very polarized situation when it comes to this.
One of the questions that keeps popping up is, we can talk about, attracting people into public health, or what doctors can do or public health officials can do, but what can individuals do to try to turn the tide to where science isn't something, or medicine, health is not seen as polarized or politicized?
Yeah, it's I remember back when I was in medical school, people talked about, the trusted professions in our society. Medicine was always at the top. Still individuals respect their physicians. And I think this is where the medical community really has to speak with a voice and saying, listen, you're hearing all this different kind of information, but these are really what the facts are about this, and that it is safe to have your children vaccinated. It is safe for you to be vaccinated. If you get COVID, as far as getting treated with antiviral agents. So again, that becomes very important. And then also, focusing within the different communities, community leaders, community voices, making sure that we reach out to groups and organizations that have an impact in their communities, so that the community leaders will be able to, if a question comes up, they'll have somebody to be able to go to.
You mentioned measles in your presentation. How concerned are you and public health officials about something else like COVID? We've seen the avian flu, it hasn't moved into the human population, but it seems like it's moved into some mammals. How concerned are you that if something serious like that were to break out, now that we've already set the grounds, we've already sort of have this new paradigm, that it would just be a real big disaster.
Yeah, no question about it. Even avian flu, the reason people are so worried is that avian flu really can have a very high mortality. One individual has been known to get avian flu from cattle in Texas. It doesn't appear to jump human to human with this one, but it's something which, is something worrisome that we have to keep a very close eye on. So, going into the pandemic, early on, talking about political polarization, the red states and the blue states pretty much did the same thing over the first 6 to 8 months of the pandemic. And then things split. So the concern is that if something happens, if states tend to go things alone, then we're going to be in a situation where it's going to make pandemic control, much more difficult.
You mentioned, how things were the same, or the responses or the perspectives were pretty much the same up to a certain point. And I want to go back to what I mentioned before, that we were in an election year. Do you feel like, it was used as a political tool in an election year, regardless of the health of our populace?
I can answer that with what we saw. So, a very contentious election at the end of 2020. President Biden, is inaugurated in January 2021. All the way up through April of 2021, there was pretty much widespread vaccine promotion all across the United States. But after that point, there was a shift where COVID vaccine promotion began to wane in many red states. So that's when we started seeing a shift at that point.
Do you think we could have wound up where we are if we lived, or if the pandemic happened pre-social media?
There's no question social media has become a bullhorn, a megaphone for misinformation. Halfway through the pandemic, articles were written how a lot of the misinformation about COVID vaccines could be attributed to 12 individuals whose message ended up getting amplified. And one of the issues that we have now is, where's the filter? Things can go out, things can spread so rapidly, and they can sound so convincing that it's really difficult for people to know what they're hearing is not accurate. In terms of hydroxychloroquine, ivermectin, other potential therapies that potentially could be harmful, end up being embraced. Vaccines, which have an outstanding safety profile, more than 700 million doses of COVID vaccines have been given in the United States. There's excellent safety profile with them. But why is it, when the boosters came out last year, that even the most medically vulnerable people older than 65, why is the vaccination rate less than 30%? And so again, this is a real consequence of what we're seeing: false information, misinformation getting out there, getting amplified.
I was reminded of the quote, and I looked it up. It is not actually from Mark Twain. It is misattributed to Mark Twain, but I think it's really pertinent. Is a lie can travel halfway around the world before the truth puts its shoes on. And in the world of social media, that's where we find ourselves. They can flood the zone with misinformation, and it's basically impossible to keep up with it. That's a real challenge for public health. I can't imagine that's something that you were taught when you were coming up as a med student.
Yeah, it's also in healthcare in general also now. In terms of, treatments and things like that. I think we're in a situation now with the polarization, the attack on the experts, attack on public health experts, attack on medical experts, that, families, with what's out there in social media. Some people just don't know what to believe, which gets back to one of the questions that you asked me earlier. What can we do? And again, I'm going to come back to the voice of the healthcare provider. And this is where we have one-on-one meetings with individuals. We could be on school boards, we could be on advisory boards. This becomes really important in helping people understand, really what the facts are.
Now, this is sort of a philosophical question, and I'm not sure, I mean, you're not a psychologist, but it seems to me that it's really hard to admit you're wrong. So once you've taken a position in a place where we're as polarized as we are, you can't change your mind without having to admit you were wrong about something as important as health. And I feel like, once the positions were staked out early in the pandemic, it just siloed everybody off to where we can't bring it back together. Does that make sense?
Yeah, I mean, one of the other things too is, going back to early days of COVID, again, this was a new virus. One of the things that really distinguished COVID from flu is the asymptomatic spread. You don't really see that in flu, but with COVID, you are more contagious 2 days before you develop symptoms than almost any other time, during the illness. So we were learning about that in terms of the role of how it spread, respiratory versus aerosol, and the role of mass availability. And I think, one of the things that we need to recognize is that when we're dealing with the pandemic, new situations, that things are going to continue to evolve. And those of us as messengers of public health and healthcare, it's okay for us to say, listen, this is the information that we have now. We're going to continue to learn more about this, and our guidance may shift, rather than, if the guidance shifts, having the individual being vilified for saying, all right, the information we have is different now, and our recommendations are going to change. This is one of the things that we have seen, particularly the attacks on CDC, attacks on other healthcare leaders. Well, you said this, you said that, you're wrong then. How can we trust you now? So this, again, ends up being, in terms of the communication of public health, the communication of medicine. We're learning as much as we can, and as things change, we'll keep you informed.
My last question, because I think I'm kind of toward the end of the time allotted for me. Do you miss anything about living in Florida, about you being at the University of Florida? You didn't, I feel like you may not have left had things not played out the way they did.
Of course, I miss Florida. And, one of the reasons that I left was because, first of all, I'm mostly from New England. My family is up here. And I wanted to stay in public health. I love pediatrics. I love pediatric endocrinology, but public health really enamored me. And the opportunity to join one of the top schools of public health in the country, top public health schools in the world, was just so incredibly appealing. The ability to work with Dr. Jha, who ended up becoming the White House COVID coordinator, is just really fantastic. So, I had great friends in Florida. When the snow is coming down here and it's 0 degrees, I certainly miss Florida then. But great friends, great times. Love being at the University of Florida, and really relish my role as being State Surgeon General and working with tremendous people there.
Right. Well, it's been a pleasure talking to you. I hope I helped enlighten some things to some degree. I'm going to hand it off to Norbert, or I think maybe Dr. Mike Martin's coming in next.
So I just want to call on Mike Martin. So it's a pleasure for you to ask the first question.
Well, first, let me say this to Scott Rivkees. During the pandemic, he met with all 12 university presidents once a week. And I guarantee you, he saved people on campus and he saved us, because his advice was always on target, always honest. And Scott, I will be forever grateful for the care that you gave each of us every week during a period of absolute chaos in some ways and great uncertainty. Here's just a statistic that I think confirms yours, and maybe you can comment on it. If I have my numbers right, 10 of the 15 states with the highest COVID death rate are red. 12 of the states with the lowest COVID death rate are blue. And if that is so, and that's a reflection of people's attitudes toward things like vaccination, ought we really be sending some strong messages, particularly to the people of my vintage in those states that have among the highest COVID death rates in the country? I mean, isn't there a target audience here that's pretty vital if those statistics are roughly right?
I'm not sure if you can hear me, but I want to first of all also express my appreciation and while we're waiting for Scott to unfreeze, these technologies are amazing when they work. And in fact, we just lost them. And they're amazing when they work, but when they don't work, there's a challenge. And I also want to say for all the attendees, this program is co-sponsored with Ask Nurses, Doctors, and Floridians for Democracy. Any health professional, as I said in the chat, who's interested in being more involved, either on the political or on the legislative end, whether you're from Florida or not, feel free to write us at www.asknursesdoctors.com, and that will come to us who are working. We have a chapter in Florida of healthcare professionals, and definitely welcome you to be involved. I'm not going to take the temerity of answering. So what I did was I divided the questions into three parts while we wait for Scott to come back. There were a couple clinical questions. There were a couple of there was a set of questions that I would say more policy/political, and then there pertaining to COVID, and then there were a couple questions pertaining to non COVID questions, but that are public health related. So I am not going to answer them, and I will just wait. If we can just certainly feel free to continue to send in questions. And we will definitely try our best to answer them. And if we don't get to many of these questions, I'm sure we can get written responses from Scott and myself to respond to these important questions that people have raised. I've grouped the questions together as appropriate, and we'll certainly go on from there. With respect to, I just want to highlight that there are some efforts. So I had a meeting yesterday with the first employee and the executive director of a new coalition for Trust in Health and Science, based in Washington, D.C., which is a consortium of 100 organizations. I met with her yesterday, trying to figure out different ways, as we all struggle to answer these questions that are fundamental as to how do we, I'm not even sure saying, how do we get back? But so that was a meeting yesterday.
Yeah. I'm sorry, I'm back now. I'm not sure what happened.
Not to worry. These are the wonders and vagaries and joys.
Yeah. Okay.
And so what I was saying was that and I'm going to go right to it. I grouped the questions together.
Thank you.
And the first set of questions that are very brief, but are more, shall we say, clinical and specific. One is, obviously, you've alluded to it a bit, but if you have from Fred, is where do you think our next pandemic will come from? What kind of virus? And then specifically with respect to the medications, are the medications as good as vaccinations for COVID? I think it's a question. Those people might be saying, I'll take the meds if I get sick from COVID, so I do not need the vaccine. So those are the clinical questions that we have so far.
Okay, so working backwards for the first question, vaccination versus medication. As I mentioned, the updated COVID vaccines, their effectiveness lasts 6 to 9 months, similar to flu, which is why you have to get it every year. In terms of current data, in terms of vaccine efficacy against severe COVID, 60 to 70%. In terms of the antiviral agents, against COVID, even a little more effectiveness against severe COVID. And the two in combination really decrease the risk of severe COVID, even for individuals most medically at risk, by 90%. So if you're not going to be vaccinated, if you get COVID, particularly if you're at risk, it's very important to get the antiviral medications. Some insurance companies cover it. Sometimes they will only cover it once for individuals who don't have insurance. Some states will have special programs for that. So that ends up being a challenge. But, a vaccine really is the first step. And then where is the next pandemic going to come from? We don't know. One of the things where the last several pandemics have come from, comes from these wet markets where you have mixing of exotic animals and people. And we know that is not something which is good. H5N1, again, with cattle. So it's likely will come from a different species that will mutate, hop into humans, and then if it hops into humans, stops there, one thing. But then if it goes human to human, like we saw with COVID, the Spanish flu, then we end up with a very severe outbreak.
Thank you so much. And I think these issues are just so complex, and that's why we need to have the support of public health professionals, like you so well articulated. There are two questions, one from Dan and one from Paul, that address in part, and just want to see if you want to expand on them in any way. Certainly, from a public community perspective, Dan asked the question, and then I'll ask Paul's question at the same time. Since there's so much misinformation about public health, how do we educate the community about it? Even from a community perspective, should we develop a campaign to address it? So this is what we as community members. And then Paul asked the question, is as clearly one of the people most experienced with fighting to resist the politicization of medicine and science, particularly in a hostile environment, what wisdom do you have for the rest of us as healthcare professionals on this? And if you want to just expand, you touched on some of these points, but certainly the point of significant interest to people.
Yeah, community partnerships are critical, and community partnerships just don't happen overnight. They have to be built. So it's really important that, whether it's faith-based organizations, different kinds of civic groups, that people in the medical community are involved with it. Early, in the pandemic, one of the most impactful things in my role were the conversations we had with the faith-based ministries. Before, the early days of COVID, when worship services, were going on, we were worried about the spread in congregations. And on Fridays, I'd have calls with sometimes 16,000 ministers talk, and they wanted to know what kind of information, how do I keep my congregation, safe? And they looked to me for answers. And part of this is because relationships that we had built beforehand. So it's really important that reach out in the community, know your community, know that you can be a trusted voice in the community that they can call upon. So, that's really one of the critical features of public health, healthcare, is community outreach, which is how you build community trust.
Thank you so much. David, an anonymous person, asked two questions that are kind of the flip side of each other. So I'm going to put them together. One is, are there countries we can look for to learn from in regards to how we should respond to the next pandemic? Who did well and why? And then David asked the question, which countries were the worst or are the worst today for anti-vax movements?
Yeah, I can't comment on which countries are the worst for the anti-vax movements. I just don't know that. But let's look at the UK. First person in the world was vaccinated with COVID vaccines in the UK. The UK, I believe, actually has a cabinet level position on behavioral sciences, and incorporated a lot of the ways about how do you build community trust for the public health good. So that is one example. In terms of mortality rates, people do comparisons, country to country. No country was unscathed. But the other thing is that every country is very individual. Each country has very different populace, different kinds of politics. So the important thing is to tailor it to what is present in the country. One of the areas that I think that is important for us to focus on going forward, really has to do with involving the general community, and how do we keep society functioning in a situation where you're dealing with a very serious pandemic. Because early on in the pandemic, unemployment rate went above 20%, schools were closed, parents couldn't work. Recognizing that this is a new virus, the lessons learned really are that what can we do to allow society to function the best that it can in the face of very difficult circumstances. Building off Mike Martin's comment about how we worked with Board of Governors. So the kids in Florida, the university students, were able to go back to school in that fall of 2020, and they did a great job. Masks were available. We talked about ventilation. The K through 12 students went back also over that period of time. We had more than $700 million in support from CDC. And of the 6,000 schools in Florida, we saw outbreaks related to school activities in less than 10% of the schools. So we show that by using public health practices, measures, that there are things that we can do to allow people to continue to live their lives.
Thank you so much. Now what I'd like to do is go to a broader set of questions that are more political. And there's two kinds of political questions, and you'll comment them in whichever way you want. One is restricted to, shall we say, Florida, and one is sort of national. So I'll start with the Florida, and I'm going to just kind of read you the flavor, and then I've put them together, and then you can go from there. What do you think of DeSantis punishing school districts that wanted to have mask mandates in the height of the pandemic? Why hasn't the Florida Medical Board reprimanded Joseph Ladapo for his anti-science public stance? Why aren't the people distributing misinformation corrected by the Florida Board of Medicine? Why did Dr. Rivkees stay silent when he was working for DeSantis? What does he think of Ladapo? And can however we see Ladapo maintaining his license and others keeping their licenses after promoting treatments that have no scientific support. Florida is a classic example where the political leadership was committed to the lie. You tried to fight the lie, and what did you learn from that experience? So I'm particularly, maybe some of what do you learn from that experience, and then tying in whichever way you'd like to any comments. And obviously you don't have to comment on anything you don't want to need to comment on.
Yeah. So first, a couple of things. So first, in terms of local control and local influence, and in terms of look at the schools, there was a difference for the kids going to school in 2020 versus 2021. 2020, the contentiousness was, should kids go back for face-to-face education? And some school districts did. Wanted to, some didn't. And if you look nationally, some states that kept the kids at home, whereas many states, the kids went back to school. And every community is different. And my feeling is that, in terms of what the specific recommendations are, or things that are implemented by the local areas, they know their population, they know their vulnerabilities. It's best left to the schools. When we went into 2021, this is where any school district that had a mask mandate, school district leaders could potentially face, financial penalties. And if we looked at what was the consequence of that, my gosh, it just tore communities apart. You had school board meetings, people were yelling at each other, front page newspapers, and that was totally unnecessary. That did not have to happen. So again, local rule is something that is that I think is very important. And then as far as the other questions that you had asked, I think this really has to do with in terms of the medical community in Florida. In terms of, how does the medical community of Florida view what is going on? Are people saying things? Are people not saying things? Are people afraid to say things? And this is where I got into the conversation about just culture. And, I, get lots of calls from people of Florida, people at certain universities in Florida saying, Scott, can you do something? And I go, I'm up here in Rhode Island. You're in Florida. Don't be afraid to speak out if you have a concern. Follow the principles of just culture, where we really need to make sure that we are embracing dialogue about these different issues.
Thank you. Now I'd like to kind of look at it from a broader national perspective. There's a number of questions, some of which did highlight a national perspective and then, went back to DeSantis. So I'm going to quote Dale here. As a physician, I've been incredibly disappointed in the silence of the AMA and other national organizations as these anti-science politicians continue to spout lies and disinformation. Why have they failed us? Or another way of saying it, again, going back to Florida, why is organized medicine afraid to speak about DeSantis and others? So maybe broadly speaking about the perceived, at least, absence of either organized medicine and or individual healthcare professionals, physicians, and otherwise.
Yeah. So first of all, in terms of the AMA, I remember the time when the president of the AMA said we have two pandemics, the pandemic of COVID and the pandemic of misinformation, and that medical boards at the state, local level should really take action to address things that if physicians are knowingly spreading false information. So the AMA has made statements about that. I'm a member of the American Academy of Pediatrics. American Academy of Pediatrics has also made statements in terms of pro-public health, in terms of trying to make sure that the right information is getting out there. And then the other thing too is don't forget several medical organizations are now being called to testify, in Congress, for vaccine promotion and things like that. So, it's a complicated landscape that we have now. And I think many medical organizations are sort of walking the tightrope as to how do we make sure our patients know the right information? How do we protect our patients, and doing so in such a way that doesn't trigger backlash against us?
Thank you. Now, just a specific question from Nancy. Do you truly believe the number of deaths in long COVID in Florida, given some of the attempts to change deaths by COVID to deaths by patient secondary diagnosis?
Yeah, that's a really important question, and it's a national question. So, in terms of we are very specific during the pandemic to identify deaths due to COVID from deaths as an incidental cause. And this was something that we looked at very carefully in the state of Florida. Actually, the auditor did a report on this as well. And I remember, there was a situation where the individual, I believe in the Orlando area, sadly died in a motorcycle crash, tested positive for COVID, and that hit all over the newspapers. Well, that person wasn't attributed as a COVID death. I also find it a bit disgraceful and disrespectful to the people who have passed away from COVID, trying to, almost minimize what their cause of death was. These individuals have passed away. Their friends and families have been affected. And, let's not forget the number of individuals who are no longer on this earth due to COVID-19.
Thank you. Couple sort of I would say, clinical/public health questions. One from Susan. Now that we have more data, what do you think of masks? And then secondly, the question pertains to whether or not schools should have been forced to use federal pandemic funds for improving HVAC systems.
Yeah, I'll go with the second, issue first. So, and which also ties into the issue for masks. So one of the things we knew early on was that this virus, spread much less outdoors than indoors. And ventilation, and this also is known early with respiratory viruses, that ventilation can actually make a big difference. Even before the federal government, which was, I believe it was in February of 2021, released their ventilation guidelines. I was talking about the importance of ventilation in the business sector as early as April 2020, recognizing this effect. So ventilation absolutely can make a big difference. As far as schools received lots of funding over the course of this pandemic, and one of the things that schools could use funding for was to improve their ventilation. I know different schools are of different ages and costs are different, but all across the country, many schools have upgraded their ventilation. As far as masks, it all depends on context. It depends on the type of masks. Second, how they're worn, and has to do, with the setting. In terms of, in the school setting. So, for example, there was a study published in the New England Journal when a school district in Massachusetts went from mask mandates to having no masks. And I believe that, there was about 10 to 20% increases in cases of COVID, a modest amount were used in that setting. And again, in terms of the type of masks, N95 masks can be effective. So again, it really depends on the context, depends on the setting as well. Some situations, if you have very close quarters and things like that early in the pandemic, no question that it made a difference. If you're in a situation where you have good ventilation, then the mask will have less of an effective role. So it really depends on context and setting. I do want to comment, one of the things that has gotten a lot of notoriety was a paper published in the Cochrane Reviews, where ended up saying that masks don't work. Well, it didn't say that at all. So out of the 12 studies that were there, 9 of them didn't relate to COVID, 3 of them related to COVID, and the 3 that related to COVID showed that there was an effect of wearing masks on COVID transmission.
Speaking for myself, I know that because I had to go overseas for work recently, and I was virtually the only person on the plane wearing a mask. And when I see patients, as I saw patients all day today, the practitioners, virtually all of them, are still seeing masks in our practice. I would say about half the patients are wearing masks, and so I'm definitely one of those that errs, I think, for myself correctly on using masks. And certainly when I go to the supermarket, things like that, where it might be crowded. I'm going to a music event tomorrow where it will be very crowded. I'm wearing a mask.
So is it an N95 mask, Norbert?
It sure is.
Yeah. In terms of masks, we can talk about 2 things, 2 purposes. One is decreasing asymptomatic spread, where it's very clear that, it will decrease both aerosol particles and respiratory particles from somebody who's potentially asymptomatic and spreading it. And if you're wearing it to protect yourself, it's pretty clear you have to wear an N95 mask. This virus has also evolved. Early on, we were talking about an incubation period that went from 7 to 14 days, where you had a big period of asymptomatic transmission beforehand. With the variants that we have now, the incubation period is much less, and it really behaves much more like flu in terms of symptomatology.
Excellent points. I'd like to switch gears a little bit, but putting on your training hat on, um, from David and Anonymous, are there national strategies happening now which will expand the amount of healthcare workers, non-professional and professional? Is anything like this happening in Florida? Which states are leading the way, and what does their template look like to fill the open positions in medical centers? How about asking the public health college programs to ask their medical schools to tackle this subject with the legislature? How can we improve funding and support for public health?
Yeah, so first, CDC has made lots of funding available for building public health workforce and public health infrastructure. And states have to apply for this funding. I know here in Rhode Island, we have this funding to lead to advanced training of public health workers. I don't know what Florida is doing, but many, many states have taken advantage of that funding. A great idea in terms of talking about broadening medical education to continue to incorporate more public health. I know here, and actually many places across the country, I give lectures about public health in terms of the role that public health can actually have in healthcare and keeping the population safe.
Right, I think so. That's good that we addressed that topic. I'm going to go back and forth a little bit, and this is more of a political, shall we say, if you want to reflect on this at all, from two people. I'm concerned about the personal freedom argument put forward by DeSantis and Ladapo. If we are free to expose children and vulnerable people to potentially lethal disease by refusing vaccination, then are we not free to drive under the influence? Is there not a premium to be paid to live in polite society? Another one along the same vein is the denialism at the leadership of Tallahassee is hard for me to understand. Do they really think they can outthink a disease? And lastly, if you wish to comment at all, you've experienced, and this is sort of tied in, if you have any personal commentary on this, you've experienced the vindictiveness of political leaders. How can we ask leaders to stand up to that?
Yeah, so all really important, interesting issues. I think it really comes, back to the point of, people in medicine, again, speaking with a clear voice, trying to speak to elected officials so they have a trusted voice that they can go to in these very difficult, situations. I do feel that during the pandemic, many, many people from both political parties reached out to me to actually say, Scott, tell me what really is going on here and what I need to do. So again, I think it really comes down to the fact that, we have to build ourselves up as trusted leaders in our communities, conversations with our patients, conversations with local organizations, and not being afraid to have conversations with elected officials. The more people know you, the more they'll respect you as well. So again, it really comes down to really grassroots communication to address these issues.
I can't agree with you more. And I'm reminded how, Scott, at the beginning of the pandemic, and certainly in the first 6 months to a year, there were, for example, videos created by Democratic and Republican physicians who were members of Congress doing joint efforts to try to, do quote unquote the right thing as it pertains to COVID. So it is possible, and it was done. And I, like you, believe that it can happen again.
Yeah.
So thank you for that comment.
Along those lines, one of the things that we actually did at Brown is we had a special workshop called, Pandemics and Democracies. How are we going to deal with this? Where we actually had roundtable discussions, members of the Trump administration, Republican governors, Democratic governors, different government officials talking about how do we come up with a common playbook that people can agree to. And take the politics out of it and try to let science and the data really guide things. So it is possible, Norbert.
And that's why, we both do the work that we're doing in our own way. Cheryl has a question. Do the restrictions on COVID vaccines mean that in the future they might not be available to those who need them or want them? What's your perspective on that, Scott?
Yeah, I'm not sure in terms of restrictions on COVID vaccines. So, in terms of COVID vaccines, we have the mRNA vaccines, which are still available. We have the Novavax vaccine, which is available. We're going to have the updated boosters coming in the fall. So, this is something that just like how your healthcare provider will order vaccines for other vaccine preventable illnesses, flu, shingles, pneumonia, they should all have these COVID vaccines. These COVID vaccines are still available. And, we're going to get into the situation where, every fall, particularly between the window between uh, Halloween and Thanksgiving, where you get a flu vaccine and get a COVID vaccine at the same time. And then for some individuals, also an RSV vaccine. So they should be part of routine medical care going forward.
I'm going to go back one more time to masks, if you don't mind. You
Sure.
want to just quick brief comment on cloth masks versus non-cloth masks and KN95 versus N95.
Yeah. So first, if you want a mask that is going to protect you, it really has to be an N95 mask. In terms of KN95s, they are effective, little less effective than N95 masks. A cloth mask is really not going to protect you, but if you have COVID and you're coughing, it will decrease the size of the aerosol particles that you may emit. So a cloth mask, if you think you have COVID or asymptomatic, will protect others. If you really want to protect yourself, you really have to wear an N95 mask. And again, ventilation is really, really important, both for COVID and also for the other respiratory pathogens like flu.
All great questions. Thank you so much to the audience. We still have a few minutes left and certainly welcome any last questions. I'm going to ask you to comment now on a non-COVID question. And the first one is, could you please share your perspective, if you'd like, on the multiple public health consequences there are, now I'm quoting directly from the question, the draconian Florida 6-month abortion law, or a 6-week abortion law, I think, more precisely.
As a physician, it has always been my belief that delicate discussions and delicate decisions should be left between the individual and their physician. So, in terms of what the impact of the new laws in Florida and the impact in other states, what we're seeing is that, healthcare, Norbert, never used to be red state, blue state. We didn't define healthcare by our borders, whether it has to do with the care of individuals who want gender affirming care, individuals who want abortions. We're in a situation now where people are now going to have to travel distances for the kind of care that they desire that's not offered in their states. And it did not used to be this way. So, it is going to have a hardship on individuals. So again, public health has become, we had education becoming a political wedge issue, diversity programs, a political wedge issue, transgender care, a political wedge issue, reproductive rights, a political wedge issue. So we really are, having really red state and blue state healthcare for many issues. One of the things that people need to be concerned about has to do with physician recruitment. And, the workforce is mobile. And one of the things that people are already reporting is that in terms of the residency match, in terms of physician relocation, it is having an impact on that. So for growing states like Florida, this is another thing that not only influencing the care individuals can receive directly themselves, but in terms of the healthcare workforce that will be able to deliver care.
One of the things that I always do is I try to start on time and I end on time. So this is going to be the last question, and then I'll make a closing comment and hand it back to Jim for his closing comment. But before I ask the question, I want to, first of all, again, it's really a joy and a pleasure to have known you over the past approximately a year now. And so I look forward to continuing to work with you. My last question from the audience is from Mary. Do you have any, and I'm going to expand it if you don't mind, Mary. Her question is anything about the legislation passed during the 2024 legislative session in Florida pertaining to health professional recruitment or loan repayment and licensure requirement changes. And I guess I would just broaden it, Scott, to if you have any state legislation around the country that you'd like to highlight that you think is particularly interesting and important from a positive perspective. By nature, I tend to try to be positive. There's lots of challenges, but what are some of the state legislative changes you've seen in addition to that question from Mary?
Yeah, I'm going to back into it a little differently. I think the environment is really, really important. Is it a state that has just culture? Is it a state that has psychological safety? Already we're seeing, as I mentioned, practitioners moving away from not moving to states that are thought to be more medically restrictive. So I think you really have to start there with that. And then as far as other things that states have had, I mean, one of the things that Florida had a big expansion in terms of residency positions under Governor Scott with recurring funding that way. Loan repayment programs can be helpful. Some other states have actually, if you're an international medical graduate, we had many, many wonderful international medical graduates that I worked with, very talented. They have to do a residency again to get licensed. And there's some states, I believe Tennessee, where you can practice in a supervised setting to the limit of your license. So, so those are some of the things that states are doing, expansion of medical school slots. But again, the climate and the culture becomes very, very important. People want to be proud of the state where they want to work. And again, the conflict which we're seeing now, where these culture wars are spilling over into medicine and to healthcare will probably have the dominant effect.
Well, so I'd like to kind of close from my end, and then I'll hand it to Jim. When Don George says, and I'd like to expand this, he says, "What a brilliant answer to the abortion question. Thank you." And I want to say that I really appreciate all the really interesting and important and informative answers you gave to all of the many, many questions that were highlighted. I want to again invite anybody who's a health professional to be engaged with Ask Nurses and Doctors as the co-sponsor of this event. I want to thank Jim for doing an amazing job, and thank everybody, Mike and others, for all the amazing job they did with the technology here. So these technologies are not a given, and it worked almost perfectly. And I'd like to give the last word at 8:29 to Jim Nathan. Thanks again, Jim.
Thanks, Norbert. Scott, wonderful job. Great. Mike Canary, thank you for doing your usual great interviewing skills. Rich and the Florida Veterans for Common Sense. Our partnership affiliation with Ask Nurses and Doctors is wonderful. A great plug there. We had a program recently with Dr. Kate Arnold. We had some technical issues, but the recording is now all set. We'll be getting that notice out to everybody. And that, along with the recording from tonight, will be placed on the Florida Veterans for Common Sense YouTube, and it will also be on the YouTube for Floridians for Democracy. So people will be able to see this. Refer others to it. They need this information. They need to understand and need to be comfortable to speak up and speak out. We can't just let this eat away at us and be frustrated. You know, the story that came for others and they didn't come for me. well, they've just come after the public health officials that we thought were sacred. Who's next? So we appreciate it very much. Our board chair is still on the line. He sort of got cut off when we froze before. I'm going to ask Mike Martin for the last final words, and thank you much, everybody.
Well, thank you, Jim, and thanks, everybody. Norbert, thank you. And again, Scott, thank you for what you did for, at least for me and my colleagues during the pandemic. We could not have gotten through without you, I promise you that. And I hope that out there somewhere, if we face another one of these circumstances, there's a Scott Rivkees around to help us all understand what's going on. So I hope everyone will take Jim and everyone else's admonition seriously. It's time we step up. It's time we save this system. And it's time we defend democracy before we lose too much of it. So thanks to everyone, and especially to you, Scott. Thanks for taking the time.
Thank you.
Thanks, everyone. Have a great night. Appreciate your support, and we'll be back with some more.